There is something about prolongation of labor and cesarean section. Patient comes to you in labor and wishes to deliver her baby normally. But sometimes we have failed to fulfill her wishes and take decisions to do emergency cesarean section. But why? Firstly, we prepare for normal delivery and start to watch for progress of labor. Progress of labor is mainly estimated as cervical dilatation and descent of fetus. When the combined time of first stage and second stage is more than arbitrary time limit of 18 hours in primary gravida and 14 hours in multigravida, that means labor seems to be prolonged. We have to be serious and alert at that time for the baby and the mother. Now, baby start to suffer from fetal distress and mother start to be exhausted. We have to now think what's the causes of this prolonged dilatation of cervix and decreased descent of fetus. Normally, dilatation of cervix is started with labor pain. That means a starting of contraction of uterus. This contraction forms bag of water which is responsible for dilatation of cervix. Improper contraction or abnormal contraction causes pain which start before contraction and passage off after relaxation in case of prolonged labor, which is obviously due to improper and abnormal contraction. And this abnormal contraction is indication of prolonged labor. Normally, pain starts after contraction and passage off before relaxation. Second thing is uterus to contract at every 15 to 30 minutes for 30 seconds initially, then 3 to 5 minutes for 45 seconds later on. If this rhythm is disturbed, then there is alarm for delay in dilatation which may lead to prolonged labor and its complications, which becomes compulsion cesarean section for obstetricians. Obstetricians tried their best to improve this protracted dilatation of the cervix with the advent of oxytocin, the uterotonic agent. But injudicious use of this again causes fetal distress, as due to prolonged labor, and its injudicious use also causes abnormal uterine contraction frequently, which in turn also hamper the dilatation of the cervix and leads to prolonged labor. This all causes delay in first stage of labor, decreased descent, which causes delay in second stage of the labor, have paid attention to us defect in passage and passenger. As example, hydrocephalus, malpresentation, contraction of pelvis, pelvic tumors, and cervical dystocia, etc. After their failure of these trials, at the end moment, compelled to them to undergo cesarean section, which, which will be against a patient wish. Defect in passage and passenger is known as cephalopelvic disproportion. Along with trial of labor in prolongation and at the end cesarean section, we can do also premature induction of labor to deal with the cephalopelvic disproportion. Passenger means head of fetus and passage means pelvis. This disparity occurs either due to average sized baby with a small pelvis or due to a big baby with normal sized pelvis or due to presence of big baby and a small pelvis. One of the example of CPD, disproportion of pelvis with fetus, is android pelvis or platyploid pelvis with hydrocephalus. Besides fetal distress, obstetricians have to decide to do cesarean section. Also, cord prolapse and capit formation start to occur. When labor is prolonged, fetal distress occur. But why? What's the causes of this occurrence? There is two things. One, hypoxia, and second is defect or disturbances or of retroplacental circulation. Sinus node which autonomic body to discharge independently decreases its discharging due to the hypoxia. In case of prolonged labor, mother is exhausted, going to be exhausted, and this exhaustion causes less availability of oxygen in circulation, and in turn it reaches from the mother to the fetus in the same form, and there is also fetus suffer from hypoxia, and in turn bradycardia or fetal distress, and ultimately maybe cardiac death of the fetus occur. As soon as we notice the signs and symptoms of hypoxia from which mother is suffering, and so her baby consequently, we scrupulously start to supply oxygen. In next video, I'll be present with how we can establish again or correct the uteroplacental circulation disturbances. Thanks so much.